Welcome to Steady Badge's Stories. I'm glad you're here tonight. If you believe the quietest person in the room is sometimes the most dangerous one to underestimate, hit like, drop a comment telling me where you're listening from, and subscribe so you never miss what comes next. Tonight's story begins with a bad joke made in front of witnesses and ends with a hospital that will never be the same. Stay with me. Dr. Bryce Caulfield made the joke at 7:42 on a Tuesday evening in February, in front of 11 staff members, 2 security cameras, and a waiting room full of frightened families who had nowhere else to be. Outside Cranbrook Valley General Hospital, a blizzard had been building since noon. By evening, it had swallowed the highway clean. The roads into the Kootenays were white and invisible and mean, and they had already claimed 5 vehicles in a chain collision near the Moyi River Bridge. A lumber truck that jackknifed, a minivan that couldn't stop, 3 passenger cars that had no time to react. Paramedics were still cutting one of them free when the first ambulance rolled through the hospital's bay doors. The ER was already understaffed. A gastrobug had taken out 2 nurses and a resident. The surgical team was running behind on an emergency that had come in before dinner. The charge board was full and the hallway was loud with the particular noise a hospital makes when it knows something worse is coming. Laura Hennessey was restocking the airway cart when the call came through on the radio. 5 inbound, multi-trauma, ETA 6 minutes. She was 37 years old, medium height, lean the way people get when stillness is a discipline rather than a personality. She wore navy blue scrubs and kept her dark hair tied back without ceremony. Her badge said RN. Her face said nothing at all, which was the thing that bothered Caulfield most about her, though he had never examined why. She set down the laryngoscope blade she was holding and began moving supply carts before anyone told her to. Caulfield appeared from the administrative corridor at 7:39. He was the chief of medicine at Cranbrook Valley, 51 years old, silver at his temples, the kind of man who had learned early that confidence and competence were different things and had bet heavily on the former. He carried his tablet like a prop. He had been in a budget call for the last hour, and his expression carried the residue of that irritation. He looked at the board. He looked at the incoming radio report. He looked at the gap in coverage 2 nurses down, Dr. Priya Vasan still in surgery upstairs, the ER physician on shift already managing a cardiac arrest in Bay 4. Then he looked at Laura. She was already at the bay entrance, gloves on, organizing the triage cart with the efficient calm of someone who had done this before. Not nervous, not performing, just working. Caulfield had written Laura up twice in the past year. Once for going above triage protocol on a pediatric case. Once for filing a safety concern about the overnight staffing model that had landed on the regional director's desk. He had called her insubordinate in the second memo. She had not responded to it. He crossed the floor toward the bay entrance and raised his voice enough for the room to hear. Hennessey. He gestured toward the ambulance doors. You've had opinions about our triage process since the day you got here. Let's see what you can do. 5 patients, all yours. The room went quiet. Deb, a senior nurse who had worked the Cranbrook ER for 19 years, looked up from the medication cart and went still. Theo, the R tech, stopped wheeling a monitor and stared at Caulfield. Yvonne, a second-year resident standing near the charge desk, opened her mouth and then closed it. Caulfield smiled at the room. It was not a kind smile. I'm documenting this as a learning exercise, he said. The board has been asking about frontline accountability. Tonight we'll see some. Laura turned around. Her eyes were dark brown and very steady. She looked at Caulfield for exactly 2 seconds, long enough to understand what he was doing, short enough to decide it didn't matter. Then I'll need Deb and Theo, she said, and someone to keep families behind the yellow line. Caulfield laughed once, short and sharp. Sure, why not? He stepped back toward the administrative corridor. The ambulance doors opened. The first stretcher came through fast, pushed by a paramedic named Santos whose hands were red from the cold. The patient was a man in his 50s, construction jacket still on, chest moving wrong, shallow on the left, overcompensating on the right. The second stretcher came right behind it. A woman in her late 30s, neck collar, unconscious. The third, a teenage boy, maybe 16, pale and rigid and very quiet. The fourth, an older woman, white-haired, talking without pause in a voice that kept cracking. The fifth, a man in his 30s with a crushed forearm and a pressure cuff already maxed out. 5 people. 5 sets of alarms. 5 families who would be at the ER entrance inside the hour if the roads held. Laura stood in the middle of it. Bay 1, she said, the chest. Bay 2, unconscious female. Bay 3, the boy. Bay 4, Mrs. She looked at the paramedic. Calloway, Santos said. Ruth Calloway, 72. She was talking the whole ride. Bay 4, Ruth. Bay 5, crush injury. Theo started moving. Deb moved faster. Yvonne looked at the resident beside her, a young man named Garrett who had been on shift for 9 hours. Are we helping? Yes, Laura said without turning around. Garrett, Bay 5, Yvonne, Bay 3, do not let the boy go quiet on you. Caulfield watched from behind the glass wall of the administrative corridor. He had his tablet open. He was, in fact, documenting. Bay 1 moved first because it had to. The chest patient's name was Harold Fenn. Santos had caught attention pneumo developing en route, trachea starting to shift, breath sounds absent on the left. He gave Laura the update in 14 words and she didn't ask him to repeat any of them. We need a thoracic surgeon, Deb said. Vazan is still upstairs, call her. Laura snapped gloves and leaned over Fenn. She checked the tracheal deviation herself, checked the vein distension at his neck, checked the way his color had moved from pale to gray in the time it took Santos to finish his handoff. Caulfield's voice came through the bay window. Nurse Hennessey, that assessment is beyond your scope. Laura did not look up, then come in here and do it yourself. He did not come in. She found what she needed on the airway cart. Not because someone had labeled it, but because she had reorganized that cart herself 3 months ago when she noticed the needle decompression kit was stored behind the intubation tray, 3 seconds further than it needed to be. 3 seconds. She had filed a note about it. Caulfield had not responded. She performed the needle decompression with Deb holding steady and Fenn's oxygen monitor, climbing back from 81 to 91 inside 90 seconds. Garrett called out from Bay 5. His pressure is dropping. What's the reading? 84/50. Get a line in and run saline. If it drops below 70, call me before you do anything else. Yes, Garrett said, and she heard the particular quality of a resident who was scared but functional. She'd take it. Bay 2 was bad for a different reason. The unconscious woman's name was Karen Dutil. Her wallet had come in the bag with her. Santos had found a medical alert card. Type 1 diabetic insulin pump. The pump was damaged. Her blood sugar when Theo got a reading was 31. Deb looked at the number. That's dextrose, IV push now. Laura was already drawing it up, and checked the pump site for skin damage. If the cannula tore, she may have been dumping insulin for longer than the crash. How did you know to check the pump site? Laura handed Deb the syringe. Push it slow. She didn't answer the question. Karen Dutil's eyes opened 6 minutes later. Not fully, not clearly, but they opened. She made a sound that was not a word but was closer to a word than silence. Deb said quietly, there you are. The blizzard hit the hospital at 8:17. Not a gust, a wall. The kind of February storm that comes off the Rockies with no warning and no apology. The power flickered once, then twice, then dropped entirely for 4 seconds before the emergency generators caught. When the lights came back, they came back in strips. Bay 1 first, Bay 3, Bay 5, Bays 2 and 4 stayed dim. Ruth Calloway in Bay 4 called out immediately. Hello, is someone there? I can't see very well without my glasses. Yvonne was in Bay 3 with the boy. She looked across the hall at the dark bay and froze. Laura was already moving. Yvonne, she said as she passed, the boy's name is Declan. Ask him his name, ask him to squeeze your hand. Do not let him be alone in his head. She entered Bay 4. Ruth Calloway was 72 years old, a retired school librarian from Fernie, who had been driving back from a granddaughter's piano recital when the truck came across the center line. She had a fractured wrist, 3 bruised ribs, a laceration above her left ear that had been dressed in the ambulance, and the particular composure of a woman who had outlived 2 husbands in a house fire and had decided some years ago that panic was a poor use of her remaining time. You're the nurse, Ruth said, squinting at Laura's scrubs. I am. Laura checked her pupils with a penlight. Equal and reactive. Good. How's the pain? Manageable. My wrist is the worst of it. Ruth paused. You're the one that man was laughing at, the one in the good suit. Laura was checking the rib tenderness, pressing carefully. Don't worry about him. I'm not worried about him. Ruth watched her work. I'm noticing you. There's a difference. From Bay 3, Yvonne called. He says his name, but he keeps drifting. Laura stepped to the bay entrance. Declan, she said, raising her voice just enough to carry. What year were you born? A pause, then faint. 2009. That's right. Stay with Yvonne. She needs you. She turned back to Ruth. Your ribs took the seatbelt load. I'm not hearing anything that tells me there's internal bleeding, but I need you to tell me the moment the pain changes character. Sharper, spreading, different. I'll tell you. Good. Laura adjusted Ruth's warming blanket and checked her wrist splint. You're the easiest person in this room tonight, Mrs. Calloway. Ruth almost smiled. That's probably the first time anyone said that about me. Bay 5 was the crush injury. The man's name was Danny Brecht, 34, and his right forearm had been pinned under the dashboard until firefighters pried the door open. The arm was splinted, the pressure cuff at maximum, and when Garrett relayed the latest reading, it was still not good. Laura came to his side and checked the compartment pressures herself, pressing carefully along the forearm. Brecht hissed through his teeth. Sorry, she said, that's important pain. Great, he said, through a jaw that was working very hard to stay unclenched. Compartment syndrome is developing. We need a surgeon. Caulfield appeared in the bay doorway. He had come off the phone 5 minutes ago, and his composure had thinned. Vasan is still in the OR. You don't have authority to diagnose compartment syndrome. Laura looked at Brecht's forearm, then at the monitor, then at Caulfield. He'll lose the arm if we wait. That's the surgeon's call. Then get me the surgeon. She's in the middle of an operation. Then get her on the phone. The room was quiet enough that everyone heard Caulfield's hesitation. Theo said from the door of Bay 5, I can page her. Caulfield looked at Theo. Theo looked at Laura. Laura said nothing. Page her, Caulfield said finally, as if the idea had been his. Dr. Priya Vasan came on the phone 40 seconds later. Laura gave her the forearm measurements and the vascular findings in under a minute, flat and precise, without hedging. Vasan said, Who is this? Laura Hennessey, RN. A beat. That's a surgical assessment. I'm aware. Another beat. I'll be down in 12 minutes. Keep the arm warm and do not move him. Understood. Caulfield was still in the doorway when the call ended. His expression had changed in a way he wasn't quite controlling. At 8:49, Yvonne called from Bay 3 and her voice had a different quality. Not panic. Worse than panic. The flat, careful tone of someone who had already crossed into controlled alarm. Laura, he's not responding to verbal. Laura was across the hall before the sentence finished. Declan was 16 years old. His mother, Santos, had told her on intake, had been in the minivan behind him. She'd been taken directly to radiology with a spinal precaution. His father was still on the highway, status unknown, because the second rescue team hadn't reached the scene yet. Declan lay under a warming blanket with his eyes half open and his color wrong. The bruising under his ribs had darkened in the last 20 minutes. Laura checked his abdomen, guarding, rebound. Internal bleed, Yvonne whispered. Possibly. Also cold and scared and running out of resources. Laura leaned close. Declan, I'm going to ask you to do one thing. His eyelids moved. Squeeze my hand. A faint pressure, barely there but there. Good. She didn't let go. Your mom is upstairs. She's being looked after. Your job right now is to stay with me. Yvonne's eyes had filled. She blinked it back. He needs imaging and he needs a surgeon, and I'm going to get him both. Laura straightened. Yvonne, you have done well. Don't stop now. She stepped out to the corridor and took a breath. Caulfield was 20 feet away, near the charge desk, watching. You've been running this department for 40 minutes, he said. This ends when Vasan gets down here. It ends when these patients are stable, Laura said, not before. You're a nurse. Yes, she looked at him, and you left 5 critical patients with me because you thought that was funny, so here we are. His face rearranged itself. I delegated in an emergency. There's a camera above the charge desk. She glanced up at it. It saw what you did. A muscle moved near his jaw. Ruth Calloway called from Bay 4, young lady, the pain just changed. Laura was already moving. The next 15 minutes were the hardest. Ruth's blood pressure had dropped. The rib bruising had spread. What had looked like soft tissue damage was now raising the question of a splenic injury. Slow, insidious, the kind that waited until you thought you were safe and then didn't. Laura got IV access and started cautious fluids. She kept Ruth's position flat and kept her talking, because talking required consciousness. You were military, Ruth said between breaths. Laura's hands didn't stop. Why do you say that? My late husband was RCMP. My son did 2 tours with the Princess Patricius. Ruth's voice was quieter now, working around the pain. You moved the way they did, like every step has already been planned. Laura taped the IV line and adjusted the rate. Rest. You didn't say no. No, Laura said. I didn't. Ruth closed her eyes. The ghost of something moved across her face. Not satisfaction exactly, recognition. Vasan came down from surgery at 9:04. She came fast, still in her oar cap, still carrying the particular intensity of someone pulled out of a procedure they weren't finished with. She swept into the ER and stopped in the middle of the room. The charge board told a story. 5 patients, all bays occupied, every monitor running. Deb met her at the desk. Laura's been running it. Vasan looked at Deb, then across the room at Laura, who was at Declan's bedside, talking the boy through a set of vitals. Brief me, Vasan said. Laura crossed the room. She gave the report on all 5 patients in under a minute. No hedging, no apology, no filler. Bay 1, decompress it stable, needs thoracic consult. Bay 2, glucose restored, pump site checked, improving. Bay 3, possible intra-abdominal bleed, needs imaging immediately. Bay 4, suspected splenic injury, fluids running, needs surgery. Bay 5, compartment syndrome confirmed, needs fasciotomy within the hour. Vasan stood very still through all of it. Who gave you surgical assessments? She asked. The patients, Laura said. Caulfield stepped forward from the corridor. Dr. Vassan, I wanted on record that. Not now. Vassan didn't look at him. She was still looking at Laura. Bay 3 first. I'll take the boy. He's 16, Laura said. His parents are both in this hospital and he doesn't know it yet. Vassan absorbed this. I'll talk to him myself. She moved toward Bay 3. 2 OR nurses came through the ambulance doors behind her, page down, though the reorganized itself the way ours do when a surgeon arrives, noise dropping, movement clarifying, the chaos finding its edges. Caulfield said, This is not over. From Bay 4, Ruth Calloway said, clearly and without drama, Yes it is, dear. 3 people standing near the charge desk heard it. 2 of them looked at the floor. One of them, Theo, turned away and coughed into his elbow. The doors opened at 9:31. Not ambulance doors, the main entrance from the parking lot. 2 people came through, coats still carrying snow. A woman in a federal identification jacket with a sealed folder under one arm. Behind her, a man in Canadian Forces dress uniform, silver-haired, the kind of face that had been calm in bad weather for decades. They stopped just inside the entrance. The woman scanned the room. The man's eyes went directly to Laura, the way eyes go to something they've been looking for. Caulfield stepped toward them. This area is restricted. The man didn't look at him. Major Colin Stroud, Canadian Forces Surgeon General's office. He spoke to the room, but he was speaking to Laura. We're looking for Laura Hennessey. The ear went quiet in a way that had nothing to do with the machines. Vassan stepped out of Bay 3. Deb put down the chart she was holding. Even Ruth Calloway, from her bay, seemed to be listening through the curtain. Laura turned from the medication cart. She didn't move toward them. She just looked at Stroud, and something in her expression shifted. Not fear, not relief. The particular stillness of someone who has been waiting for a thing to catch up with them and has finally stopped outrunning it. Major, she said. Caulfield looked between them. His confidence had been losing air for the last hour, and now the last of it went. Who is she to you? The woman with the federal jacket opened the folder. My name is Agent Francine Beaumont, Health Canada, Inspector General's office, and Laura Hennessey is currently the subject of a commendation review. She looked at Caulfield steadily. She's also the reason we were already in transit when your hospital's emergency feed hit the regional network. Caulfield's mouth opened. Beaumont kept going. We've been investigating Cranbrook Valley General for 7 months. Unusual mortality figures in the overnight triage window. Staffing decisions that don't survive scrutiny. A pattern of complaint suppression. She paused. 5 anonymous safety filings in the last year, all submitted through the Provincial Nursing Board, all describing the same systemic failures. Caulfield said quietly, That's. Those filings, Deb said, from the charge desk came from Laura. The room looked at Laura. Caulfield's voice turned sharp. She had no right to go above. She had every right, Beaumont said. She also had the background to recognize what she was looking at. She turned to Laura. Do you want to tell them, or should I? Laura pulled off her gloves. She dropped them in the biohazard bin and looked at the room. Vassan, Deb, Theo, Yvonne, Garrett, the 2 OR nurses, Caulfield, Stroud, Beaumont, and the 5 bays where 5 people were still fighting to finish the night. My name is Laura Hennessey, she said. Before I came to Cranbrook Valley, I served 9 years in the Canadian Forces as a combat medic. Last 3 years with Joint Task Force 2 support operations, forward surgical team. She looked at Caulfield. I left with the rank of warrant officer. My call sign was Anchor. She looked back at the room. I came here because I wanted to work somewhere smaller. Somewhere I could take care of people without a weapon on my belt. I didn't expect to need most of what I know. Tonight I did. Yvonne sat down on a stool hard. Caulfield pointed at her. She operated outside her scope. She performed surgical assessments without authority. Everything she did tonight needs to be reviewed. It does, Laura said. Review all of it. Her voice was very level. Review the needle decompression I performed because you wouldn't come into the bay. Review the compartment syndrome assessment I made because you couldn't reach a surgeon for 20 minutes. Review the splenic injury I caught in an elderly woman while you were standing in the corridor watching. Review every decision I made tonight against every patient outcome. She looked at the security camera above the charge desk. The red light blinked. Review all of it. Caulfield looked at the camera. Stroud spoke then, quietly. The camera feed from your ER has been uploading to the regional emergency network since 7:42. It's been logged and time-stamped. He glanced at Caulfield, including the moment you made what you called a learning exercise. The room held very still. Deb said, almost to herself, 7 months we've been filing concerns. Beaumont looked at her. We know, you're why we started looking. 2 more agents came through the ambulance bay. They moved toward the administrative corridor, with the particular pace of people who have a warrant and know where the filing room is. Caulfield said, "You can't," and then stopped, because he looked at Beaumont's expression and understood that yes, they could. Vassan came out of Bay 3. Her face carried the news before her words did. "Declan is going up. The bleed is manageable. He'll be in surgery in 20 minutes. She paused. "His mother has been cleared by neurology. She's asking for him." She looked at Laura. "Can someone take her up?" Theo was already moving. At 10:18, Declan's father came through the ER doors. The second rescue team had reached him on the highway, hypothermic and fractured but alive. When he heard both his wife and his son were upstairs in this hospital, his legs went. Garrett caught him. Laura was at the charge board. She looked over her shoulder at the sound of it. She crossed the floor and crouched in front of the man, who was sitting on a bench near the entrance with Garrett beside him. "Your name?" she asked. "Tom," he managed. "Tom Renault." "Tom, your wife has a concussion and some bruising. She's stable. Your son has internal bleeding they caught early enough to fix. He's in surgery right now, and he was conscious and talking 30 minutes ago. She let that land. He asked about you. Both of them did." Tom Renault pressed both hands over his face. Laura stayed crouched until he was ready. She had done this before, in places where the ground was frozen and the light was wrong and the news was worse. The posture was the same. Stay low. Stay close. Don't leave until they've found the bottom of it. "Can I see them?" he asked. "As soon as surgery clears it. I'll make sure you're the first to know." She stood. She went back to the board. At 11:40, all 5 patients were accounted for. Harold Fenn was in thoracic ICU, stable. Karen Dutil had recovered full consciousness and was asking for her phone. Declan Reno was out of surgery, critical but expected. Ruth Calloway had gone to the OR for a splenic repair and come back so smoothly that the overnight nurse described it as routine. Danny Brecht had his forearm, which was the only outcome that mattered to Danny Brecht. Caulfield's access card stopped working at midnight. He found this out when he tried to return to his office, and the administrative corridor locked him out. He stood in the hallway with his tablet under his arm and nowhere obvious to go, which was a position he had never been in before at this hospital, and which looked, to the people who saw it, like a kind of justice that didn't need commentary. Stroud found Laura at the charge desk at 12:15, writing her shift notes. "You always did keep writing," he said. "Documentation matters. She didn't look up. You taught me that. I taught you a lot of things. You taught me that scope of practice is a legal boundary, not a moral one." She capped the pen. "I stayed inside it as long as I could. Tonight you saved 5 lives. Tonight I did my job." She looked at him. "Why are you really here, Colin?" He was quiet for a moment. "Maddie Fontaine," he said. The name changed the air between them. Maddie Fontaine had been 9 years old, admitted to Cranbrook Valley General 3 months ago with a severe asthma attack. She had waited 41 minutes for a respiratory therapist because the overnight schedule had been cut to minimum. A cut Caulfield had authorized and which Laura had flagged in her 3rd anonymous filing. Maddie had survived, barely, with a hypoxic event that left her with cognitive changes her parents were still learning to navigate. Her father contacted the Force's liaison office, Stroud said. "He's a veteran, he wanted someone to listen. Your filing language matched JTF2 after action format." He looked at her. "I recognized the conscience before I recognized the name." Laura was quiet for a long time. "I should have been louder," she said. "You were as loud as the system let you be." He paused. "We're changing that." At 6 a.m., when the blizzard had thinned to a gray and ordinary snowfall, and the day shift was coming through the doors stamping their boots, the ER staff gathered without planning to. They ended up near the charge desk, coffee in hand, too tired to go home just yet. Deb spoke first. "I want to say something." Laura looked at her. "I've worked this floor for 19 years, Deb said. I have watched good nurses get small because the people above them needed them small. I watched it happen to you and I didn't say enough." Her voice was steady, but her hands weren't. "I'm saying it now, I'm sorry. And I'm done watching." Theo raised his coffee, Yvonne raised hers. Vassan, who had stayed through the night without anyone asking her to, said simply, "Same." Garrett, still in yesterday's scrubs, nodded without speaking. That was enough. Caulfield was not in the room. He had given a preliminary statement to Beaumont's team at 2 a.m. and been asked not to return to the hospital pending review. The charge board still had his name on the administrative roster. Someone had put a sticky note over it. The sticky note said, "See Ruth Calloway's opinion." No one removed it. Ruth had, before going into surgery, said to Theo, "That man has been failing this hospital for longer than tonight. Write that down." Theo had written it down. Laura looked at the staff around her. Deb, Theo, Yvonne, Vassan, Garrett, the incoming day nurses, the respiratory therapist who had heard what happened and come down early, the security guard who had stood at the administrative corridor door all night so the agents could work. "Thank you," she said. "Now go home and sleep. The work isn't done, but you can't do it exhausted." She looked at Deb. "Except you. I need you for 30 minutes. Deb almost smiled. "On what?" "The overnight staffing model. We're rewriting it before someone else has to file anonymously." The morning light came through the sliding doors, slow and white. Outside, the plows were working the roads. The highway near the Moy Bridge would open by noon. 6 weeks later, Health Canada published its interim findings on Cranbrook Valley General. The report named Caulfield by name and recommended criminal referral for evidence of deliberate suppression of patient safety data. It named Maddie Fontaine. It named the staffing cuts. It named 5 other patients whose outcomes had been affected by decisions made behind administrative doors. It also noted, in a section on emergency response, that the care provided during the February storm by a single registered nurse had been, quote, consistent with the highest standards of trauma triage and had directly prevented 3 deaths. Laura read the report at the charge desk on a Tuesday morning. She read the section about herself once, put the report down, and went to restock the airway cart. Declan Renault was discharged 2 weeks after the storm. He walked into the ER on a Saturday afternoon with his parents and a card he had made himself on folded paper, uneven letters, the words slightly uphill. He gave it to Laura without preamble. She opened it. It said, "Thank you for not letting go." She folded it carefully and put it in her scrub pocket. Ruth Calloway mailed a letter the same week, written on cream stationery in looping cursive. She had done this, she said, because emails felt insufficient. She wrote that she had told her son about the nurse in the blue scrubs, and that her son had said it sounded like the people he'd served with, and that she wanted Laura to know she had been seen. Not the uniform she wasn't wearing, not the rank she had set down, but her. "You stayed low," Ruth had written. "You stayed close. You didn't leave until we found the bottom of it. That's what the good ones do." Laura kept that letter in her locker, not framed, just kept. Above the charge desk at Cranbrook Valley General, 4 rules went up on laminated cards the month after the investigation closed. No patient waits unseen. No staff member is penalized for raising safety concerns. No administrator overrides clinical triage. No one is ever just a nurse. Deb had written the 4th one. When Laura objected to the word just, Deb said, "It's for the next Caulfield, so he knows before he opens his mouth." Laura looked at the card for a long moment. Then she went back to work. On the night she had walked into that blizzard-driven R with 5 stretchers coming through the doors, she had not been trying to prove anything. She had been trying to do the only thing she had ever known how to do. Find the next problem, hold the line, keep everyone breathing until someone else could take over. That was what anchor meant. She hadn't chosen it. The medics she'd trained with had given it to her on a mountain in a different province, in a different winter, because she was the one who held. When the weather was worst and the resources were least, and the situation had no good options, she was the one who planted her feet and refused to drift. She had tried for a while to put that down. To be ordinary. To be just a nurse in navy blue scrubs who restocked the airway cart and filed safety concerns through official channels and didn't ask for more than that. But ordinary hadn't been enough for Maddie Fontaine. Ordinary hadn't been enough for Declan. Ordinary hadn't been enough for 5 people on a winter highway who needed someone to be exactly who she was and not apologize for it. Dr. Bryce Caulfield had left 5 critical patients with 1 nurse, because he thought it was funny. Because he had looked at her silence and mistaken it for emptiness. By morning, 5 people were alive. By the following month, an investigation had named what he'd buried. By the time the last guilty plea was entered, the hospital he had run had become the kind of place he would never have allowed, where nurses spoke and residents weren't afraid, and the charge desk had a sticky note where his name used to be. Laura clipped her badge to her scrub top every morning. Nothing else. It was enough. It had always been enough. The rest, the history, the rank, the mountains, the hard years, the lost ones and the saved ones, all of that was hers to carry, quiet and private, like ballast in deep water. An anchor doesn't announce itself, it just holds.